Welcome to the launch of the report to the European Commission Anti-Trafficking Coordinator on the Cost of Trafficking in Human Beings. My name is Karen Shire. I'm the director of the Essen College for Gender Research at the University Duisburg-Essen in Germany, and a visiting professor at the Violence and Society Center at the City University of London, where this report was produced. I'll be chairing this meeting, and as is common now with virtual conferences, we begin with a few housekeeping matters. We would like to invite participants to send their comments and ask questions over the Q&A function. You can do this anytime during or after the reports. Half of our time today is reserved for answering your questions and comments, so we hope you will have them. Second, if we don't get to everything, and we certainly will try to, any unanswered questions and comments will be sent to the research team. Finally, a link to the recording that we're making of this event will be available probably within a few days, but certainly in a very timely manner. You can find the link on the homepage of the Violence and Society Center. So now it's my pleasure to begin with the content of our program and to introduce Professor Sylvia Walby. She's director of the Violence and Society Center and the lead author of the report that we are launching today, but also of 3 previous reports on trafficking in human beings. I'll have a few words to say about that at the end of the presentations, but now we begin with the presentation of the report on the cost of trafficking in human beings. Sylvia?
Thank you very much, Karen. So I'm very pleased to be able to launch the report. The report was written by many people: Patricia Bell, Janet Bosted, Jean Fader, Abigail Fraser, Annie Herbert, Stuart Kirby, Sally McManus, Steve Morris, Sian Oram, Jess Phoenix, Merili Pullerits, and Rachel Verrill. Lots of us, several of whom are here today to contribute to the discussion of how we constructed the report and how we put those figures together. I'm going to start by discussing the purpose of costing and what the main results were. So why cost? Isn't trafficking in human beings dreadful enough without needing to say that it costs money? So the main purpose of costing is to be able to translate the harms of trafficking into something which is understandable for the people making financial decisions as to how to allocate the resources needed to end or reduce trafficking in human beings. It shows the cost not only to the victims and survivors of trafficking, but to the whole of society. And that's its main point. That the costs of trafficking aren't only borne by the victims of trafficking in human beings, they're borne by everybody. These are costs which end up distributed across all of society. I'm now going to share my screen to show you some of the details. So this is a list of my colleagues. So we gathered information on trafficking in human beings from a very wide range of sources. Our data on the extent of trafficking is focused on the registered victims, that is, the minority of victims who register with authorities. So it's an underestimate of the amount of trafficking in human beings and is an underestimate of the total costs. We identify the harms through reviews of the scientific literature and analysis of surveys, specially collected data by the 28 rapporteurs in each of the member states of the European Union. There are challenges. Most of the victims are still not registered, and the data which is needed is not always collected. But even though we have an underestimate, our estimate for the cost of trafficking in human beings in the European Union in 2016 was 3.7 billion euros. That's each year. Those costs are borne by everybody because of the way in which the services which are used by victims are paid for by everybody. The diversion of productive economic capacity away from the legal economy into the hands of the traffickers is also a significant loss to everybody. And then thirdly, there's the lost quality of life, which is focused on the victims themselves. So as you look at this slide, you can see that the cost per victim for the cost of services is 40% of the costs. The amount which is spent on coordination and prevention, 1%, the amount spent on specialised victim services is only 3%. So we can see the distribution of costs between those for the services, lost economic output, and lost quality of life. How are the costs generated? We look at 3 different times. We look at the cost in trafficking itself, when the victim is being exploited. Trafficking, of course, is defined as the exploitation of the vulnerability of others. There's a period in trafficking when somebody is being exploited. The second moment is when the person is in services, that is, they have managed to escape trafficking in some way. But the majority of the costs are afterwards, in what might be thought of as a post-trafficking period, but is actually when most of the costs are borne. Trafficking has long-term harms. It's not only during the short period, the long period for some, of trafficking. The costs of coordination, law enforcement, and specialised services are concentrated in those first 2 periods. Health and social protection costs from the point of services and post-trafficking, lost economic output and reduced quality of life all the way through. But it's the long-term harms that we should focus on. That is, if the harms are to be mitigated or trafficking ended, those costs will be significantly reduced. The harms and costs differ by the forms of exploitation. People can be trafficked for purposes of labor exploitation, sexual exploitation, or other. The forms of violence differ: physical violence, sexual violence, or other forms of threats. There can be harms and hurts to physical health or mental health, and those costs are then differentiated. The costs per victim for trafficking for purposes of sexual exploitation are larger than those for other forms. 353,893 euros. Enormous sums for the costs of trafficking for the purposes of sexual exploitation. Costs for trafficking for labour exploitation also high, and also for other. Because of the concentration of women in trafficking for purposes of sexual exploitation, the costs for female victims tend to be higher than the cost for male victims. The costs for children tend to be higher than the cost of adults, and that's partly because of the length of the harms, the duration and depth of the harms to children. Trafficking for purposes of sexual exploitation is more common in most other countries of the EU 28. Britain is something of an outlier here, with a particular capturing of instances of trafficking for purposes of labour exploitation. More women than men are trafficked. More adults are trafficked than children. So we can put that together as a summary showing the distribution of the costs and the number of victims of trafficking. And we can show how those costs are distributed across the victim. To reflect on what that means, that one of the distinctiveness of the way in which we did our analysis was to produce a sex disaggregated breakdown. In the UK, this is not always done. So here we can see that the cost per female victim is higher than the cost of a male victim, and the cost to women as a whole, that is when we're aggregating that to the whole of the EU, is even higher. That is almost 3 times as much as that for men. And that's largely because of the greater costs associated with trafficking for sexual exploitation, where the harms are particularly long-standing. And again, we have the uniqueness of including the specificity of harms to mental health. How are the costs distributed? Would the costs be focused on prevention? No, only 1% is spent on prevention. Are the main costs on mitigating the harms by looking after the victims and the specialised services? No, only 3% is spent on specialised services. The majority of the harms, the majority of the costs are costs to the public purse for the spending on other services such as law enforcement and the diversion of economic output away from the legal economy. That's the summary of the numbers. We might ask, how and why might trafficking stop? This particular report gives us a distribution of costs. If you want to ask that question as to the different kinds of interventions, then I recommend you turn to other reports. We turn to the analysis of policy reviews of the European Union, and we look specifically also at the issues of the gender dimension in trafficking in human beings. So we welcome you to join in the Centre's work on other issues, and thank you for listening to this. I'll now turn to my colleagues who will focus on exactly how we put together these estimates.
Thank you, Sylvia. We'll now move on to the next presentation by Sian Oram. Sian is head of the section on women's health and senior lecturer in women's mental health at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. Sian will present her unique data on violence experienced by victims while being trafficked and outcomes for mental health. Sian?
Thank you. I will be speaking briefly about new secondary analyses on the mental health of victims of trafficking. The data were from a survey of 150 victims who are receiving post-trafficking support from non-governmental organisations, NGOs in England, and it was conducted as part of an NIHR-funded project called Protect. Now, the data set isn't huge, but actually in kind of trafficking terms, it's one of the larger data sets that we've got, certainly in a European setting. It comprises 98 women and 52 men, and they have been trafficked for sexual exploitation, domestic servitude, and labour exploitation. And we included within the survey questionnaires to screen for depression, anxiety, post-traumatic stress disorder, alcohol and drug use, and then also experience of threats, physical violence prior to or during trafficking, and unwanted sex prior to or during trafficking. So the secondary analyses of this dataset were really used to provide more granular detail than has previously been published on violence and mental health in this population, and also to describe the association between exposure to physical and sexual violence while trafficked and mental health harms. And so I want to highlight just 2 key findings because I have just a few minutes. If I could have the next slide, please. Thanks. So firstly, victims of trafficking report a high prevalence of physical violence, and women victims additionally report a high prevalence of unwanted sex. So you can see from these tables that 2/3 of participants had been subjected to physical violence while trafficked. Sex disaggregation showed that physical violence was more commonly reported by women, 78%, than by men, 44%. Unwanted sex was reported by almost half of the sample. Unwanted sex was more commonly reported by women, again. So 67% of women, 2/3, reported this type of violence. And when disaggregating by type of exploitation, we found prevalence to be highest among women trafficked for sexual exploitation, 95%, followed by domestic servitude, 54%, and labour exploitation, 21%. Next slide, please. So my second key finding, so in regression analyses here, experiencing unwanted sex was associated with mental health harms, and specifically anxiety and post-traumatic stress disorder in the post-trafficking period. These analyses were conducted only for women, given the low numbers of men reporting this type of violence. So in an unadjusted analysis, the more straightforward analysis, women subjected to unwanted sex while trafficked had odds of current anxiety 5.58 times that of people not subjected to unwanted sex while trafficked. And despite the relatively small sample, an association remained even after controlling for unwanted sex prior to trafficking and physical violence while trafficked. Similarly, women subjected to unwanted sex while trafficked had increased odds of post-traumatic stress disorder in both unadjusted and adjusted analyses. And although evidence was more mixed, experiencing physical violence was also associated with mental health harms. So importantly, these outputs suggested that findings from the analysis of the mental health harms of violence conducted as part of this costing project using more generic mental health survey data were broadly generalizable to victims of trafficking. I'll hand back across now. Thank you.
Thank you, Sian. We'll move on now to Merili Pullerits. She is a postgraduate researcher in the Violence in Society Center, where she researches domestic violence, coercion, and trafficking in human beings. Merili will present a systematic review of all published scientific studies on the extent to which trafficking victims have suffered violence. Merili?
Thank you, Karen. So as Karen just said, I'm going to focus on the systematic review element of the study. That's because for costing purposes, we require information on victims' experiences during trafficking. And although we had the excellent data from Sian's data set, we wanted to fill the gap with information from as a large number of victims as possible. And the systematic review methodology allows us to do this in a way that means that the review is not only replicable, but it's also very comprehensive in its coverage. So next slide, please. Our focus was twofold. So first, we wanted to establish the prevalence of physical violence, sexual violence, and threats among victims of trafficking during trafficking, and also the duration in trafficking for adult victims. And in both cases, we wanted this disaggregated by form of exploitation. So following systematic review methods, we set up a review protocol, we specified all our search terms and our inclusion and exclusion criteria, and then we searched 6 electronic databases, and we screened all the resulting almost 2,000 references in a 2-stage process. For the studies that met our inclusion criteria, relevant data were then extracted and pooled together using meta-analysis. So this meta-analysis then resulted in a weighted average figure, which we used in the rest of the study. And this takes into account the various different studies, which in this case was 9 studies for the violence prevalence estimate and 10 for the duration estimate. Now in the next slide, we have the results of our systematic review. Now trafficking for the purposes of sexual exploitation was considered by definition to involve sexual violence. So that's why we have the figure of 100% there. But on the whole, as you can see, the results showed that rates of violence are high among victims of trafficking, and that these vary by form of exploitation, as does the duration in trafficking. And all the kind of information that you have and you can see in this table was then fed into other parts of the study as one of the steps towards generating the final costs, which Sylvia showed in the beginning. Thank you. I'll hand back now.
Thank you, Merili. We'll now move on to Jessica Phoenix. Jessica Phoenix is a research associate in the Violence in Society Center, where she is researching domestic violence, policing, missing persons, and she is an expert on the measurement of these issues in crime surveys. She will focus especially on the costs related to loss of quality of life of victims of human trafficking. Jessica? Jessica, we can't hear you. Yeah.
I'm back. Thank you, Karen. So the systematic review showed the percentage of victims of trafficking that experienced physical violence, sexual violence, and threats. The next phase was to make an association between experiencing those forms of violence and experiencing immediate harm and using services. Then we can go on to generate the costs. So can we go on to the next slide? So what I focused on was the immediate harm, and immediate harm was physical injury. So I used the crime survey to estimate victims of physical violence, sexual violence, and threats, which are associated with trafficking, what proportion of those victims reported receiving at least one injury. These proportions were then translated into a cost. So if we can quickly go over to the next slide, this table. So this table, what you can see is how we estimated the average cost per injury per victim for trafficking in human beings. Now we know these costs are a massive underestimate because they don't account for repetition. These costs are saying if a victim experienced one form of violence and received one injury, what is the estimated cost? And we know that victims in trafficking experience multiple and repeat forms of violence. So we know these are an underestimate. But this just kind of gives you an idea of how we generated the cost of immediate harm. And the physical injury cost went on to contributed towards the cost of the lost quality of life, which will be discussed next. But as well as the cost of physical injuries, we also looked at the costs of service use, and that included law enforcement and it included specialised services. Now, the data for law enforcement and for specialised services didn't come from the survey. Instead, they came from national rapporteurs and equivalent mechanisms in the EU member states that contributed that information. So we asked, what services do you provide and how much do they cost? And of those that provide the information, we then generated an estimated cost per victim and then an estimated total cost of those services. Law enforcement services included the cost of the police, the cost of prosecution, the cost of courts, and specialised services refers to the cost of providing a shelter, providing a bed for a victim who's just come out of trafficking, and also any wraparound services that member state provides, such as counselling. So that just gives a very, very brief overview of the cost of the immediate services and the immediate harms to give you an idea of how we went from proportions to then working out some of the costs. So I'll pass back. I'll pass back on that.
Thank you, Jessica. Our last presentation is by Sally McManus. She is a senior lecturer in health and member of the Violence and Society Center, where her research focuses on the social determinants of mental health and the development of quantitative research methods to measure mental health and well-being. Her report, as Jessica has already implied, will focus on the long-term costs of the harms experienced in trafficking on the quality of life of victims. Sally?
Hello, hope you can see that screen.
Yes.
I'm going to be focusing on lost quality of life. And we can see that lost quality of life accounted for a very large proportion of the overall cost of trafficking, about 41%. Now, Jess and Merili have already talked a bit about lost quality of life that takes place while people are in trafficking. What I'm going to focus on now is a bit about how we estimated the lost quality of life that occurred after trafficking. Now, there's no perfect data set for this. We don't have a longitudinal study of people who've experienced trafficking. Instead, as the others have mentioned, we draw together lots of different data sources. And I'm going to say a bit about how we weave those different data sources together. First of all, we anchor many of our costs in the number of people who are registered as victims in the EU in 2016, so in 1 year. That's 11,348 individuals. A large number of people, but we know it's an enormous underestimate. So we bear that in mind with all of these costs. Now, what the registration statistics tell us is that breakdown, which others have mentioned, between sexual, labour and other, in particular domestic servitude, forms of trafficking. What we did then was use the information that Merili presented on the systematic review and meta-analysis to look at the prevalence of different types of violence. So sexual violence, physical violence, threat and coercion. So first of all, focusing on the prevalence of sexual violence, we can see there are around 2/3 of those trafficked for reasons of other forms of exploitation that experience sexual violence, around 1/3 of those for labour, and by definition, everyone who was trafficked for reasons of sexual exploitation had experienced sexual violence. What we then did was look to another data source entirely, which is a general population mental health survey, to look at the long-term harms to mental health that may result from sexual violence. What we did was we compared people who had experienced sexual violence and people who hadn't in marginal effects regression analyses where we control for the exposure to other forms of violence and socioeconomic circumstances. And we estimated that the marginal increase in prevalence of long-term mental health harms was around 6.8%. And it's only that marginal increase to which we attach costs. We then used the mental health survey to also look at the duration of these mental health harms post-trafficking. And for sexual violence, this was longer than the duration of harms for some of the other forms of violence. We estimated it to be for 17 years. We then look to the global burden of disease and draw on their disability weights. The disability weight is the proportion of loss of quality of life experienced by someone with a particular condition. We use the disability weight for mild depressive disorder, which sees a reduction in quality of life of around 14.5%. And then we drew on the value of a year of life in good health. And for this, we drew on examples that have been used in previous European Commission reports of €75,000. We then can produce a value for this lost quality of life from sexual violence to mental health. And then we went through the same process all over again, looking for the impact of physical violence and of coercion on mental health. What we then did was increase a slight adjustment to reflect the fact that children are more likely to experience a greater extent of harm from violence and duration of harm from violence. Now that gives us an estimate of the long-term mental health harms. We also looked at substance dependence and at physical health conditions. And if we add that also to the information that Jess was just presenting on the emotional and the physical harms experienced during trafficking, including loss of life, then we realise that the total sum that for our estimate for the total loss of quality of life is €1.5 billion. Now, my final slide just anchors us back to registered victims. We can see that the disproportionate burden was experienced by female victims, in part because there were more female victims and because they were more likely to be trafficked for reasons of sexual exploitation and to have experienced sexual exploitation, whatever reason they were trafficked for. But the key thing as well to bear in mind is that these costs are rooted in those who are registered victims. And so it's an underestimate of the costs, both for men and for women. Thank you.
Thank you, Sally. Before we go to answering some questions, I would like to make a few comments on what we've heard today. This cost of human trafficking report, even in the underestimation of the victims of human trafficking that they were forced to rely on, shows that the costs are enormous, over €300,000 per victim, over 3.7 billion euros overall. Now, let me briefly summarize what I think some of the most important points we've heard today. First, that the economic costs are not only or even mainly lost economic output, but the cost of services and the cost of lost quality of life. Cost of economic output is about 20%. The rest together is over 80% of the total costs. Second, the costs are not specific to the moment of trafficking, what the researchers are calling in-trafficking, but are long-term, post-trafficking, stretching over the life course of victims. The costs not only accrue to the individual victims in relation to the harms that they experience, but for society and the costs of services, especially post-trafficking. The costs vary enormously by the form of exploitation, with the highest costs accruing to victims of sexual exploitation or victims of sexual violence. This is also something that happens in labor exploitation and other forms of exploitation, who are mainly women and often children. The cost of human trafficking is the fourth report led by Sylvia Walby for the European Commission Anti-Trafficking Coordinator. The first report was on the gender dimensions of human trafficking, where we learned already that sexual exploitation is the dominant form in Europe and women are most likely to be victims. Today, what we learned is that victims of sexual exploitation are also the most likely to experience all forms of violence and coercion at great cost to individual livelihoods, mental health, but also to the society in terms of resources needed for law enforcement and services. The second report went on to engage in a comprehensive review of all the research that was funded by various sections of the European Commission. And this report showed that projects funded to combat sexual exploitation received the least average funding per project. Now, today's report puts this finding in the context of much higher costs to individuals and societies for sexual exploitation, and reiterates the need to escalate attention and resources to combating sexual exploitation. The third report went on basically to try to improve on the collection. We heard that the numbers are underestimates because they're always based on registered victims with authorities in the member states, and it depends on the member states reporting those figures in a somewhat uniform and consistent way. The results we heard about today are still based on data which underestimates the number of victims. Moreover, the huge commitment of societal resources in the form of services stands in contrast with the still low number of identified perpetrators and prosecutors. This fourth report that we heard today makes clear that the costs of human trafficking are not just in trafficking, but long-term. The costs are to victims, their livelihoods and quality of life, but also to society. If we consider the huge profits that fall to perpetrators of human trafficking, then we see that this also comes at a huge, enormous cost to the quality of life in European countries. I would like now to turn to the audience and take up some of your questions. I will be calling on different speakers today to answer the questions. You're also free to direct your questions towards one or another speaker, and please let them come in. We've reserved half the time today for your questions. First, we have a set of two questions from Jessica Corsi. The first one is directed, I think, mainly at Sylvia Walby. With such a small percentage of the overall cost of trafficking invested in preventing trafficking, would you recommend increasing prevention funding? Why don't we have an answer to that? And then we'll go to the second question, which is directed towards Sally. Sylvia?
The answer, of course, is yes. But
that's a short answer.
But the complexity of it is, what do we mean by prevention? How is trafficking to be prevented? And here probably is a very complicated answer. In the first instance, we'd want to say that we want to mitigate the harms to the victims by having better specialised services so that those long-term costs can be reduced. That would reduce the cost by mitigating the harms. It's not quite the same as preventing. But specialised services are also one of the locations where expertise is lodged. So if we're to contribute to the growing of the knowledge base, the specialised services are really important as part of that broader portfolio of activities. The 1% which was put in centrally for prevention is very important and absolutely tiny. But what is prevention? What generates the exploitation of the vulnerability of others? What kinds of societies produce these kinds of inequalities which lead to the possibility that people who are vulnerable are actually exploited? So these are very large questions about social structure and how we organise societal responses, not only about the detail of what particular kinds of services we have for the most effective kinds of intervention. So my answer to Jess is everything. All of these different things are important in reducing the possibility of trafficking in human beings. And the most immediate ones are the specialised services and coordinated action on prevention are really important, but they're only the start.
Okay, thank you, Sylvia. Why don't we take Jessica's second question, which is directed towards Sally, and it's a question about your estimates. Could you please say more about the 17-year estimated average duration for mental health harms from sexual violence and trafficking?
Yes, it's a very good question. We have a real lack of longitudinal data that allows us to look at the long-term effects of violence on health outcomes. So this is an area where urgently we need more data collection on cohort studies, we need more longitudinal studies to be asking questions about violence so that we can generate much more reliable estimates of duration of harm. The way in which we calculated duration of harm in this study was from a cross-sectional study. And it looked at the age that people were at when they experienced violence and the age that people were at when we collected information about their mental health state and their physical health state. And we subtracted one age from the other to produce an estimate of duration. It's not ideal, and therefore it's very important that in the future we obtain much better data on longitudinal sources to allow us to quantify that duration of effect better.
Okay, thank you, Sally. I now have a question from Stephen Watson, and actually two questions, and he's pushing us to engage in more cross-national comparisons and European-wide assessments. His first question is, it was mentioned that the amount of sexual trafficking was lower in the UK than in other parts of the EU. Is there scope for a country-by-country breakdown of the extent of trafficking to perhaps identify the policy factors that might reduce different forms of trafficking? Sylvia, you might answer this or direct it to a member of your team.
Yes. Since most victims of trafficking are not known to the authorities, it's quite a difficult question to answer. So is it that Britain has less trafficking and sexual exploitation proportionate to labour exploitation in other countries? Or is it that Britain is actually better at identifying victims of labour exploitation than other countries? The data that we've got, that we're using in this report on the extent of trafficking, is actually information on the victims who are known to the authorities. Is there a direct proportionate relationship between the victims who are known to the authorities and the actual underlying numbers and proportions of victims? We don't really know the answer to that question. So the answer to your specific question could be either Britain is better at actually finding victims of trafficking for labour exploitation, or it could be that Britain actually has less victims of sexual exploitation than other countries. I tend towards the first one, but the evidence base for that is very slim. What we really need is better information on the extent of trafficking, which goes beyond the information that we've got, which is on those who are registered with the authorities. And that requires far more data collection, which goes out into the population and investigates those victims and survivors of trafficking and those who are still in trafficking who are not currently known to the authorities.
Thank you, Sylvia. The second question I may direct towards Sally again, but please correct me if you like. Stephen asks, relatedly, it seems likely that the quality of social provision might have a significant impact on the true costs, especially post-trafficking. And so this might also vary greatly country by country. Given the low numbers of studies included in the meta-analysis, perhaps this comes back to Merili's part, this might be something that we need much more research on. Sally, and then maybe Merili, do you have a reply to this?
Well, in terms of social protection, in terms of use of welfare support, benefits, out of work support, that sort of thing, we relied very much on a UK-based survey to estimate the extent of utilisation of social protection, and we then applied that utilisation rate to information that was gathered from European centralised resources in terms of the scale of cost. So yes, I think it's a very good point that that level of utilisation might vary by country, and we wouldn't have captured that as well as we could have done, and therefore more research could well be done on that. But I'll let Merili, because she worked a lot on the social protection data, follow up on that.
Merili?
I think in terms of just going back to the meta-analysis part of it, I just want to say that obviously we're only able to include 9 or 10 studies depending on whether it was the prevalence of violence or the duration of in trafficking, but why we had such low levels, I mean, such low numbers of studies was because we had very strict rules of comparability. So we wouldn't, it doesn't mean that there were only 9 studies or 10 studies of trafficking out there, but it meant that for the purposes of the information we needed for this trafficking study, and we needed it disaggregated by the type of exploitation, we were very strict in terms of what studies we could combine. So there was a lot of studies, additional studies that are out there, and which we had to unfortunately exclude because, for example, they didn't disaggregate by different types of exploitation, or they weren't very explicit about the way they measured, for example, physical violence or sexual violence, or they combined the two into one category. So just to note that there's definitely a lot more kind of studies on trafficking out there. But I know Sian is obviously the expert on this, so I don't know if you want to jump in and say anything.
Please do, Sian, if you would like.
No, I was actually just listening, thinking what a nice job you were doing of explaining it, Merili, so I haven't got anything further to add.
Okay. We have another question from Janet Veitch. She asks, these costs for sexual and other forms of exploitation through trafficking, would or could these costs transfer to other migrant women, refugees and asylum seekers who perhaps are not trafficked, but were also exploited on arrival in the sex industry or for other purposes? She's interested in how far this can be mapped across to all types of sexual exploitation, maybe not for people who are trafficked into the country for that purpose, but who are here and then sexually exploited. Sylvia, you might want to make a comment about this because it comes to the definition of human trafficking that we employ in the European Union.
Yes. The costs that we included here were the costs of sexual violence, which is something which is very specific. We didn't use a broad concept of sexual exploitation. If you've been trafficked for purposes of sexual exploitation, we treated that as definitional, that sexual violence had occurred. So that was the basis of the analysis that we did. I think what Janet is asking for is the cost of sexual exploitation, which is other than sexual exploitation in the context of trafficking. Now, we didn't actually do that estimate. It could be done, but we didn't do that here. We focused very specifically on the cost of sexual violence. But I understand there's a second part of your question, which is about some of the cross-national flows here. And I'm going to turn to Jess Phoenix for part of that answer, because Jess worked with me on the previous report on the data. Now, in that previous report on the data collection on trafficking in human beings across the European Union, we were able to identify the country of origin, as well as the country in which the exploitation took place. And we had some quite complex matrices which showed the relationship between the place from which people came and the location where they were currently trafficked. And we did that analysis not only for the victims, but also for the traffickers themselves. Jess, do you want to add something to that?
I don't think there's anything to add other than what we've already covered about the data report. And when I was reading this question, I was thinking the same thing, and I was referring back to our previous project, which was looking at data. And I remember that we were, especially the victims, that's where the better numbers were than for the traffickers themselves, where we did have the data on citizenship, so country of origin, and also the location of where they were registered. That's where the traffickers were registered. I don't know how we'd then apply those proportions into cost and how we'd make that relationship, but yeah, that data is there. We do have the country of origin data in the data report.
Yeah, and what we found also was a much higher proportion of people being trafficked in their own country than many people expected. So while sometimes trafficking is thought of as essentially a cross-border phenomenon, what we found was that it sometimes is and it sometimes isn't, and that sometimes a person can be trafficked within their own country. And that was something else which came out in the data report.
Okay, thank you. We have a further set of questions from Rebecca Brown. She's taking away the message that the most harmed population are female and children, but she wonders if you could fill in more about men falling victim to exploitation, and which presumably happens mainly in labor trafficking, and your thoughts on current mechanisms available for their identification and rehabilitation specifically. And in relation to that, I think too, she's wondering whether, with regard to the data in sex trafficking appearing more prevalent than that of labor, do you think this reflects the reality, or is labor trafficking easier to hide? That might be something that Jess also wants to have a go at from the perspective of crime statistics. And anybody, you can bounce it off to your team members if you like.
I wonder whether Sian might like to say something in relation to the survey, because Sian had a survey of actual victims of trafficking in Britain, and might be able to say something about the characteristics of those victims.
Yeah, happy to. So we were slightly unusual actually in that we have all types of exploitation covered within our data set. We didn't put any restrictions on type of exploitation. That is something that quite often happens. And I think it's partly sometimes because researchers are very reliant on working with NGOs to be able to recruit participants safely to research, and certainly in some settings services are more geared towards supporting women than men, and so sometimes men get filtered out at that stage because they're just harder to identify. I think in this project one of the things that became clear was the importance of sexual violence in driving mental health harm. As I mentioned, in the analyses of the PROTECT data set, although physical violence was associated with harm, the evidence was weaker than it was for sexual violence. And it is that women are experiencing sexual violence, or at least reporting experiencing sexual violence at much higher rates than are men, and also are reporting experiencing physical violence at much higher rates than men.
Thank you, Sian. The next question is from Jasmine James, and it refers also to some of the breakdowns that Sylvia presented in her slides. She'd like to know about the age group of the major number of victims. She thinks that the age is related to the cost. Can you kindly explain this issue? Sylvia?
I think this one might actually be for Sally, who has got the data on duration and children properly.
Sure.
So the data sources that we were relying on were primarily about the impact of harm as experienced by adults. So we had to generate a multiplier to reflect the increased harm for children. Now, in the data sets that we were looking at, there was scope for the participant to report experience of sexual and physical violence in childhood. And we could see that the duration of effects were longer, and that the extent of effects on people's mental health and physical health were also greater. So we applied a multiplier to those who were registered as victims as children of 1.3. And that's a fairly arbitrary number. This was the best that we could do with the data that was available to us, but it's something which there would certainly be scope for more work to explore the greater impact on long-term outcomes for those who are trafficked as children. But I hope that gives you a bit of information about how we handled it in this costing.
Okay, thank you very much. We have no further questions. If anybody would like to add one now, just pause for 30 seconds for you to type it in. Otherwise, we can move on to some final comments by Sylvia Walby.
I just wondered whether Miria Vassiliadou might want to ask a question.
Are you with us?
Okay, so are you going to sum up, Karen, or shall I?
You shall.
Okay, so you can see the enormous amount of work which went into creating this horrible number of 3.7 billion euros for the cost of trafficking in human beings across Europe, and for the extraordinarily large number of over 300,000 euros per victim. These are enormous numbers. We know that they're underestimates. You've heard every person putting this data together to say, I'm sorry, this is an underestimate and we need more data, which we do. So it's an underestimate because it's only looking at those people who are registered with authorities. We obviously want more people to go and seek help and register, and those numbers will go up, but there are those who never will register, and they should be included somehow. You've seen from the range of the evidence, we've done an extraordinary review of the scientific evidence, which is what Merili did with looking at the review of the scientific studies, trawling through multiple journals in order to create that evidence. You've seen the database that Sian had with this very detailed information on individual victims and their experiences. You've heard of the information that Jess has pulled together in not only the crime survey, but also in the previous report where we did the analysis of the data. And you've heard the analysis done by Sally, looking in particular at the long-term harms, mobilizing the findings from the Adult Psychiatric Morbidity Survey, which has enabled us to look at the harms over time in ways that people haven't previously done. It's this longitudinal dimension that I think is one of the unique contributions of our particular way of looking at the costing of these harms. It's not just the harm in 1 year. It's not just the immediate cost while you're suffering. And it's not even that period as you up to the point of entering services. These are harms which go on for years. People are damaged so much by trafficking. And Sally has managed to extract that information from these surveys, and we've managed to collectively piece that together. This has enabled us to create the sex disaggregated analysis, which hasn't always been done. And we're able to show the disproportionate effects of the different kinds of trafficking and the extent to which the harms are particularly concentrated among those who have been subject to sexual violence. This isn't to underestimate the harms and the costs of trafficking for victims of other kinds. The cost of trafficking for victims of labour exploitation is still well over 200,000 euros per victim. Even though we're saying that the costs are concentrated in some places, that does not underestimate the costs of trafficking, the harms of trafficking to all victims for whatever form that they have been subject to. We've seen a variety of methods of attempting to intervene on this. We've seen the costs for strategizing, which are quite small. We've seen costs of very specialized services, again, quite small, the 3%. We've seen slightly larger costs for law enforcement. Of course, we need law enforcement. It's really important. Does law enforcement need further development? The laws in this area are still developing. We've seen discussions in the European Union as to the extent to which the directive 2011 is fully implemented. The directive itself was related to the 2000 Palermo Convention from the UN. We've seen in the last 20 years the attempt to deepen the legislation, and that in itself has given impetus to the whole much wider variety of interventions. When we've seen new forms of legislation, we've seen then packages of associated activity to attempt to implement that legislation. And indeed, this report comes out of that attempt to deepen the implementation of the 2011 EU directive on trafficking. But all of these forms of intervention matter. One of our findings was the analysis of the costs to the economy. This is the direct diversion of human resources away from the legitimate economy. This is a consequence of a crime which distorts the economy. These are very substantial losses to the economy. So from the point of view of the people interested in the economy, employers, trade unions, these are issues which concern them. This is an issue for the Treasury as we see the diversion of resources away from the economy. But let's not also forget the long-term harms to the quality of life of the victims and survivors. 40% or so is our estimate as to those costs. And these costs are so high because of the long-term damage to human beings. Now, let me finally reflect on what it means to cost. I always hesitate at costing. I mean, these are things which are terrible and they should be intervened on because they're terrible. They're crimes, they're harms to human rights, they're devastations, they're forms of pain, they're death. People die from this. That these things matter in their own terms. The purpose of putting a cost on it, putting a euro sign or a pound sign on it, is to translate it into an additional, not alternative, form of discourse on public policy intervention. This is a way of mainstreaming the analysis of this crime, of these horrors, into financial decision-making. The decisions as to how to prevent and eliminate trafficking will require the mobilization of public resources. And the point of this kind of exercise is to demonstrate that these harms have an effect upon the whole of society, are a cost to the whole of society, and enable us to translate it into the language that decision makers in the Treasury, in finance ministries can understand. These are figures which can enter in the UK, we call it the Comprehensive Spending Review. These are figures which can enter into public decisions about the distribution of resources. So what we've got here is a contribution to public debate. It's just one part of a contribution of scientific, social scientific knowledge to contribute to the wider agenda of reducing all forms of violence and coercion. And that's where we as a centre sit, trying to develop the knowledge which is needed to inform the public policy decisions which are needed in order to push back on, hopefully, one day, reducing or even ending a variety of forms of violence and coercion, of which trafficking in human beings is one significant part. So thank you all for listening to us. And thank you for all of your excellent questions. They have been very important and interesting questions. And let me finally thank my colleagues for their extraordinary expertise and willingness to condense their months of work into 2 minutes in such a succinct way. And finally, Karen, for chairing it and for looking after us all as we've attempted to show our findings to the world. Thank you.